Good afternoon. I'm George Latimer, Westchester County Executive, and this is Thursday, December 17th, and we're here to provide our second COVID update of the week to cover where we are with the outbreak of the infection here in Westchester County. I'm joined by Deputy County Executive Ken Jenkins, and the news story of the last 24 hours has been the question of the snowstorm that's hit us in Westchester County. We're pulling out of it now because the weather is nice, and I'm going to ask Ken to give an update specifically on that area of public concern, which will probably be more substantive for today's update than just our COVID situations. We had originally asked Mayor Mike Spano of Yonkers to join us for today's update, but pretty clearly with the snow emergency, he needed to be on duty in Yonkers, and he's doing a good job down there in that city. So we'll have him as our guest next week at one of our updates, as we will continue to have various elected officials who are chief executive officers of their communities, so that we get some sort of sense of what's happening with COVID, not just countywide, but locally in the circumstances. For those who follow these things, we have suspended sharing the community breakdown map over the last number of days. We are trying to get additional information and more accurate information to share, so that we have numbers that, in terms of active cases or total cases, compare to what we're seeing on the state tracker. We've often indicated that there's a couple of day lag between the information we have and the information that gets, from the state gets given to us that we report on. And we were trying to narrow that gap so that we had accurate numbers, but also to try to add numbers of hospitalizations and fatalities by municipality. We need to have a data line link between the state government and us to do those things, and to do that in real time to be of some benefit. So we are still working on trying to get that established. And when we do, we'll be able to put the maps back out. Now, we've had a steady increase in the number of positive cases. So when the next map comes out, whatever day it is, whether it be tomorrow or next week or whatever it is, you will see a significant jump in the number of cases, reflecting the number of positive cases that have happened in the days since we last put out the municipal map. So do not be alarmed by it. If it's more accurate, then it's more helpful. And if we can have additional data on it, that's really what we're striving for. The information that we just have off of the New York State Tracker today shows actually a decrease in the number of active cases for the first time in memory, a fairly surprising decrease. And I think we attribute it to the fact that with the incoming storm yesterday, we did not test quite as many people as we have in the past. We've had days where we've broken 10,000, 11,000 tests, and yesterday that number was under 9,500. So nonetheless, we had 571 active cases yesterday, and that was less than the number of active cases from 2 weeks ago. So therefore, we now have 8,693 active cases in Westchester County of COVID, on a baseline of 61,111 cases year to date. The 8693 number is less than what we had on Sunday, Monday, Tuesday, and Wednesday. We were last at this number, or slightly above this number, back on Saturday on the weekend. We have 1,584 fatalities. That number has risen by 3 in the last day, but we've had a tough week. We had 6 fatalities on Wednesday. Tuesday into Wednesday, we had 7 fatalities. Monday into Tuesday, and we had 6 fatalities on Sunday into Monday since our last report. So that is concerning that the number of fatalities are rising as the number of cases are rising. The last number that we had on hospitalization dates back to 2 days ago, when we had 360 individuals hospitalized. And the hospitalization number does oscillate. It goes up and down based on individuals who has the disease and is healthy and is able to go home, and then how many people contract the disease and are impacted enough by it to go to a hospital to get additional care. The number of 360 of 2 days ago is an increase over where we were in the last few weeks, but it has gone up and down. We were up as high as 372 people hospitalized earlier in the week. So actually the 360 number is down by 12 from that number. In general, I think we've made the case before, we don't need to make it every single time we speak, is that our numbers are much higher today than they were a month ago, much higher today than they were in the early part of the fall, and it's almost incomparable now to the summertime months, where we had very low level of infection, low level of hospitalization, and a low level of fatalities. But we have lost 1,584 individuals to the COVID virus since the 1st of March. And as we approach the end of the year, that's a very stark number. It fits into a 300,000 person number nationwide. We want to mention that, there's always been a perception that COVID is primarily a disease that affects those who are older. And it is true that of the fatalities, over 80% of the fatalities are for people 60 years of age and older. So oftentimes that is the most dynamic indicator of where we might find fatalities, but it's generally because people of a certain age also have other illnesses that they have. There's a comorbidity factor, and it is more prevalent the older you are, and that oftentimes is why those numbers are the way they are. We don't necessarily realize that people in middle-aged years, young adults, and children also are very vulnerable to COVID. Those numbers kind of get washed away in the larger numbers that come from those who are seniors. We have learned that there are more cases in Westchester of the pediatric syndrome that's called multisystem inflammatory syndrome. And that syndrome in children, there's an acronym MIS-C, is a condition where different body parts can become inflamed. And that includes the heart, the lungs, kidneys, brain, skin, eyes, gastrointestinal organizations. They become inflamed by the exposure that they have to the COVID virus. The cases are very few, and the condition is very rare, but it is something to be aware of. And you may remember this spiked up sometime in the late spring. We had a couple of days in a row where we had cases of young children that were contracting this, and we had a couple of fatalities over it. But while the conditions is rare and cases are very few, it usually starts out as abdominal symptoms. And in the cases where we've seen them in Westchester, other members of the family had COVID. So we make the correlation between COVID infection within a family affecting these young children, and there's usually about a 4 to 6 week incubation period. So I think the important thing to take out of this is that COVID is not just something that will hit vulnerable senior citizens. It will hit people of all ages, including young children. And you should be on the lookout, if you have a young child at home, for any kind of abdominal pain that seems unusual. There's no correlation to some physical activity that would have generated it. And certainly consult your family doctor right away. If there's testing that's appropriate, we'll get testing right away and get healthcare right away. As with every other kind of medical situation, early detection and early treatment is always the best strategy. But that is very much a part of what we're dealing with in terms of this COVID outbreak. And I'm going to ask Ken Jenkins to talk about the update of where we are in terms of the snow incident that we had. It started yesterday, somewhere in the 4 o'clock hour, got more intense about 6 o'clock. We have sunshine as of about 11 o'clock this morning, 12 noon. But we went through a period of time of intense snow. Lots of different services were impacted by it. So to give you an update of where we are now, the Deputy County Executive, Ken Jenkins.
Thanks, George. Certainly we had the snow scenario where we had the nor'easter come through the northeast part of the country in Westchester County. Meteorologists were all on target and talking about how devastating and how the storm was going to be. First, the Beeline and our paratransit service went back online at midday today. So Beeline and paratransit are back online. They're running a revised schedule. And in the revised schedule, it's on some snow detours, especially in the hilly places like Yonkers, the routes 8, 13, 19, 30, and 32. So certainly check on westchestergov.com at Beeline Bus on our website to just check those information on the routes and the changes that have been made. But Beeline and paratransit have been resumed today at midday. Metro North is operating on a normal weekday schedule. You should anticipate that there will be scattered delays because of the weather and because of things that may have happened due to the weather. Westchester County Airport, the scheduled departure flights are on schedule. Some arriving flights may have reported delays. Check with your carriers as you would normally do. We would certainly want to make sure that in Westchester County, we had some high snow totals up in Mount Kisco and Yorktown Heights. We had 11 inches that was reported to the National Weather Service in Mount Kisco and both Yorktown Heights, 11 inches. Obviously, with all of the wind gusts, and there were significant wind gusts that were happening, those snow piles could be much higher. Today, the snow started to stop right around noon, but later on this afternoon, we had some additional flurries that happened throughout the afternoon. Between noon and about 3 o'clock, we'll have some additional snow showers, so don't be surprised if you see that. It's going to get sunny, and the high is going to get somewhere around 29 degrees. Again, many people should be staying off the road as much as possible. I know all of our folks that have been doing a tremendous road work cleaning the streets, as far as our DPW workers in the various municipalities where the county has responsibility on the Bronx River Parkway and the Playland Parkway primarily. They've been able to clear those roads and get those things clear. Tonight, we're going to get down into with the wind chill into the teens. So please be careful if you go out there, as the county executive mentioned in our earlier press conference during the week, to make sure to prepare yourselves, make sure that you're keeping all of those same things that you need to do should you have to go out. Make sure that you have food in the car, make sure the car is gassed up, and make sure you're wearing some warm clothing and take a blanket just in case. Friday is going to get up to near non-freezing at 31 degrees. And we're going to continue to have those wind chills. But we want to make sure that we let you know that both the Department of Transportation and our County Department of Public Works are reporting and working hard to clear those roadways. Please, again, continue to stay off the road if you're able to do so. And if you are not able to do so, please take your time. Thank you.
Thanks very much, Ken. I'm just going to mention, as well as a tie-in to what we've just heard, that we had a variety of electrical outages over the course of this storm. Interestingly enough, the intensity of this snowstorm and the inches that it dropped and the winds that were generated was not as impactful on our electrical grid as was Hurricane Isaias that came through back in August, and it spent about 2 hours in Westchester County. And then the upshot of it is that it caused damage that were multiple days in trying to resolve. So it's hard to figure out which kind of storm has which kind of impact on our electrical grid. But in this particular case, there are no outages reported at the present time for any of the NYSEG clients. They represent about 10% of Westchester County, the northern tier communities, stretching across that North Salem, Yorktown, Somers, Cortland corridor in the northern part of the county. Con Edison is the supplier distributor for 85-90% of the county, and they have all of lower Westchester and a fair bit of northern Westchester as well, going into the Bronx and the 5 boroughs of New York City. They have reported 11 outages, 397 affected customers. So it's a little heavier than the last report, which had around 195 customers that were out. At one point last night, we had 1,100 customers out in Yonkers, but they've all been restored. So the restoration factor has been much better than what we've experienced in other storms. And some of the outages now are in Bedford, Buchanan, Cortland, Greenburgh, Mount Kisco, North Castle, Peekskill, and Yonkers. And that's, of course, a wide spread of communities from one end of the county to the other. All of that is important. I should note that this storm was probably about as good a storm as you would hope for, in the sense that it came after the rush hour in the evening, and it was on the verge of being completed as we began the morning rush hour. What also helped is that since we are in a working remote format, many of the people who would otherwise be on the roads or on the commuter trains and buses did not need to go in the office. They're working remotely. And then also, most of the schools in Westchester County have closed for the day. Some operated on a remote learning capacity, as was already part of the equation. And some of them just simply closed and took a snow day. But whatever the local circumstances were, there were that many people also not on the road, taking kids to school and going through that type of situation. So all in all, we had a quick turnaround. I think we're pretty close to back to normal. We've been able to do most of the things that we wanted to do as a county government, the local governments also as well. And I think we all owe a debt of gratitude to the men and women of our Department of Public Works, both in the county and in the municipal governments. We have earlier this year praised our healthcare workers as an addition to the public workers that we routinely place, which are our first responders, police, fire, and emergency services. But we've added healthcare workers to it. And in the emergency of a snowstorm where we want mobility and we want connectivity, our DPW workers really did terrific work. So we want to thank them for that. And I think it does tell you that public service is a noble profession. Those who work for the government are not government workers. They're people who are committed to a sense of mission, and they're out there in the middle of the night where we're sleeping comfortably, trying to get the roads clean and help stranded drivers and all the other things that happen during a snowstorm. So Joe Scamato, our deputy director, is here, and we have a question remotely from one of our press contacts. If there are any others, they can contact Joe or Catherine Chaffee. We'll go from there.
All right, we got two questions from Samantha Crawford from News 12. The first is, the Moderna vaccine may be approved by the FDA later today. Do you know how many doses of their vaccine the Mid-Hudson region would be getting?
Samantha, we have not received that information from the state. We know that the state has laid out some plans about how the vaccine would be disseminated. We understand that the priority after getting to all of the healthcare workers would be to get to nursing home workers and staff. So maybe that's how it's targeted, but I don't have direct knowledge of what those plans are. And I would look to the governor's announcements on that area.
Okay, and one more about the vaccine. When do you predict the general public will be able to be vaccinated, and what will you and your team do to build public confidence in the vaccine?
Well, I think the best guess that we have now is that sometime in the beginning of the spring, they will be ready for general population vaccination. People who are not seniors and not impacted by illness and not special essential workers. And if that comes by the 1st of April, that means we still have another 3.5 months of going through the discipline that we've shown so far. Once we know what that schedule is, we are working now on a game plan to try to help communicate to people not just what the plan of distribution of vaccines are, but to give them some confidence that the vaccine is something they can trust. And I certainly understand there are a lot of folks out there who have a general distrust for reasons that are well documented in the society, that they don't think anything government says or does is honest or fair. And whether or not that's right from case to case, in this particular case, if we're going to fight the pandemic, we need a relatively universal response to taking the vaccine so that we know that we don't have the potential of an outbreak that will cripple the society as we already went through in 2020. So we will take it upon ourselves to communicate publicly. We'll have proper spokespeople from the medical community talking about the science and talking about the specifics of the vaccine and so forth. And, there's no doubt, and no different than when I was, 7 years old. I told the story yesterday. I remember going to the doctors for a variety of vaccines every so often, and I hated to go. My mother would have to pull me out of the house, knowing that I was going to get a shot. I didn't want to get a shot. I probably cried at some age and all that. But the bottom line was the inoculations that I received for the mumps and German measles and chicken pox and all these other things kept me safe because I never contracted any of those diseases sufficient enough to warrant a health crisis. And many children before those vaccines came along died from some of those diseases. So it's very important. Child of my generation, anybody who shares that, growing up in the 50s and 60s can relate to what I've just said. If you come along later, it's different, but we have to do things that are prudent for our health. I took a flu shot this year. Flu shots are not 100% effective. You can get a flu shot and you might get the flu. Your arm might hurt a little bit after the flu shot, and maybe for the rest of the day you feel it. But, those aren't reasons not to embrace something that will help us keep you safe and help us keep the society safe. So as we know more, Samantha will be happy to share it with you as we can. Any other questions? No other questions. So if there's anyone from the press who wants to reach out to us, feel free to do that through our communications tool. We'll be happy to talk with you. We're scheduled to give our next COVID update next Monday. And then, of course, that week, because Christmas falls on Friday, we'll do our update, I think, on Wednesday. So the next two updates will come on Monday of next week and Wednesday of next week. We've already done press conferences on the weather, and we did one when we signed the budget yesterday. So we'll try to step back a little bit, give you a little space, and give you some information, but not try to have you tune in every single day unnecessarily. I'm George Latimer, Westchester County Executive. Thanks for watching. Stay safe. Have a good weekend, and we'll see you on Monday, unless there are reasons to communicate on any emergency basis prior to that. Have a good day.